Hello friends, in this video we will discuss Rajasthan Mo Fmt questions, and these are PYQ questions taken from last 8 papers, and I have also made videos on other subjects also, so you can also see them. So let's start with the first question in FMT today. So first question is foamy liver is seen in. Foamy liver is seen in case of decomposition. In decomposition, gas production will be there, and foamy liver is also seen in decomposition. Hashish is a preparation of. So hashish is prepared from cannabis sativa. So cannabis sativa is the correct answer. Other thing that can be made from cannabis is hashish, tincture, ganja, bhang, and cannabis sativa is also called as Indian hemp. So correct answer will be cannabis sativa. Next question is which section 319 IPC deals with. So 319 is related with simple hurt, and 320 is related with grievous hurt. So answer here will be option number C, which is hurt. Next question is following are the primary skin incisions used in autopsy except. So we know that in autopsy most commonly used incision is midline incision, which is also called as the I shape. So most commonly used is I shape. V-shape incision is not used in autopsy. Other incision which can be seen in autopsy are one is I shape, one is Y shape, another is modified Y, and X shape, and also T shape. So these are all type of incision that can be used in autopsy, but V-shape incision is not used in autopsy. So answer here will be option number 2. The combined method of homicidal smoothing and traumatic asphyxia is. So this is a direct question. Combined homicidal smoothing and traumatic asphyxia is known as burking. So answer will be option number B, burking. Suspended animation develops in the following condition except. So this is fact-based question. Suspended animation develop in drowning. This is correct. It is also seen in sunstrokes. In suffocation, it is not seen because suffocation is the purest form of asphyxia. And suspended animation is not seen in the case of suffocation. It is a pure form of asphyxia and can lead to death. In electrocution also suspended animation can be developed. So answer here will be option number C, suffocation. A combination of heroin and cocaine is known as. So a combination of heroin and cocaine is known as speedball. Smack is the other name of cocaine only. Molotov cocktail is not a cocktail. It is a type of bomb which have gasoline inside it. And coma cocktail is a combination of the three medications, and used in case of unknown poisoning. So coma cocktail can be given in any case of unknown poisoning, and its MAC is the cocaine only, and its cocaine plus heroin is known as speedball. Moral principle which should guide members of the medical profession in their dealing with each other is known as. So this is a direct question. Answer here will be medical ethics. These are the medical ethics which a medical professional should follow while dealing with each other. A doctor examining an unmarried girl discovered that she was pregnant. He talked about the matter to his friends in a restaurant, revealing her identity. So, as the doctor has revealed the identity, so it is a type of crime, and what would be his liabilities? So, options are university may withdraw his medical degree. Yes, this can be true, but not a correct option. The court may order him to pay compensation. Yes, this is true. State Medical Council may erase his name from medical register. This is also true because it is a type of crime, revealing the identity of any pregnant or those who has undergone the MTP. The doctor may incur dual liability of paying compensation to the patient and also getting his name erased from the medical register. So this is the best answer among them, that the doctor will has dual liabilities. So option D is correct option. A boy attempts suicide. He is brought to a private doctor and he is successfully cured. Doctor should, first option is inform police. This is true. No need to inform police. No. Uh, as the boy has attempted the suicide, so it is a type of medical legal case and doctor should inform the police. So answer here will be option number A. Other options are report to magistrate. No. Uh, the doctor should report first to the police, and if it is required, then police will report to the magistrate. Keep under observation for a week. No, this is not true. The first thing that doctor should do after curing should be to inform the police. So option number A is correct option. Consent for medical examination is not a must in physical examination of a victim of rape. No, this is not true. Um, Here, consent is very important. Physical examination of the arrested person if requisition is given by SI of the police. So, in the option number B, if the requisition is given by SI of the police, then consent is not needed. So here, um, the examination can be done without consent. The examination of the woman for pregnancy, consent is required in this, and examination of the drunken person. Here also consent is required. So answer here will be option number B. When you treat a case of viper bite, you should keep watch on. So viper has a venom which is hematotoxic, and hematotoxic, and it can lead to coagulopathy, and increase in the clotting time will be there. So while treating the case of the viper bite, you should have a look on clotting time, and 20 minutes clotting time test is done in case of viper bite. So answer here will be option number B, which is a clotting time. And is type of joint present in carpometacarpal joint. So this is not a question from FMT. It is a orthopedic question, and answer here will be saddle joint. So first carpometacarpal joint, which is a thumb joint, is saddle joint. Other carpometacarpal joints are plain synovial joint. Which of the following drug is preferred for the treatment in the case of organophosphate poisoning? In case of organophosphate poisoning, we have to give two drugs. The drug of choice is or antidote is atropine, and also for the reactivation of the acetylcholinesterase enzyme, we will give 2-palm or pralidoxim. So atropine is mainly for the symptomatic relief or the curing the symptoms, but for reactivation of the acetylcholinesterase enzyme, we have to give 2-palm or pralidoxim. So answer here will be atropine. First class judicial magistrate can fine rupees up to. So if we talk about first class judicial magistrate, then the fine will be 10,000 rupees and 3 years imprisonment. So answer here will be option number D, 10,000 rupees. Commonest type of fingertip pattern. So there are three type of fingerprint patterns. Arches is there, loops and holes. So most common among them is loops. So if we talk about arches, then it look like this. In holes, like this, and loops, like this. So most common among them is loops. The age of consent for sexual intercourse for female in India is. So this is a direct question. The age of consent for sexual intercourse in female in India is 18 years. So if less than 18 years, any sexual intercourse, either with consent or without consent, will be considered as rape. So after 18 years only, the sexual intercourse should be done, and that also with the consent. Route of entry for British anti-leviside, which is also called as BAL, is, so it can be given intramuscularly. This is a direct question that BAL should be given intramuscularly. Target organ toxicity of oxalic acid is. So whenever there is a toxicity of oxalic acid, it will mainly lead to the damage to the kidney, because oxalic acid mainly excrete through the kidney. So it will lead to the toxicity in the kidney. Next question is organophosphorus insecticides are toxic to human due to, so they have the capability to cause the irreversible inhibition of the acetylcholinesterase enzyme. So toxicity of OP poisoning will lead to the irreversible inhibition of the acetylcholinesterase enzyme, for which treatment is, one is atropine, which is for symptomatic relief, and for reactivation of the acetylcholinesterase enzyme, we should give pralidoxim or 2-palm. The most reliable criteria for Gustafson's method of identification is. So Gustafson's method of identification is used for determining the age in adults by seeing the progressive changes in the teeth. So the most reliable method among criteria in Gustafson's method is transparency of the root. Option number B is correct. All these are the criteria, but among them, transparency of the root is the most reliable criteria. If we talk about second reliable criteria, then it will be root resorption. A deep incised wound. Langerhans lines determine. So Langerhans line are the tension line, or they are the natural tension line, and in the deep incised wound, they will determine the gaping of the wound. So answer will be option number V. Gaping of the wound is determined by the Langerhans line because these are the tension lines. Sexual asphyxia is associated with. So in sadism, the sexual pleasure is um, acquired by uh, giving pain to others. In masochism, sexual pleasure is acquired by giving pain to himself only or self only. So answer here will be masochism, in which a person closes his nostrils, so there will be deficiency of oxygen will be there, and it is also called as the sexual asphyxia, and he will get the sexual pleasure from this. Maggots in rainy day are seen within. So maggots in rainy day are seen within 2 to 4 days. If we talk about the cycle in flies, then it is firstly it is egg, then maggots, then pupa, and then adult flies. So eggs is seen on 1 to 2 days, then maggots on 2 to 4 days, then pupa from 3 to 6 days, and adult from 6 to 9 days. So answer here will be option number C, 2 to 4 days. What is the professional death sentence? Professional death sentence is imprisonment for whole life. No, this is incorrect. Rigorous imprisonment. No. Erasing the name from the panel of RMP. Yes, this is correct. Professional death sentence is erasing the name from the panel of RMP. Option number 3 is the correct option. All the following accounts to criminal negligence except. So there are two types of negligence. One is civil negligence and one is criminal negligence. So operation on wrong patient, this is criminal negligence, and error in diagnostic or diagnosis or treatment. So this is not a criminal negligence. It is a type of civil negligence. Operation on wrong limb or amputation, this is criminal negligence. Leaving instrument or sponges in the abdomen or any other part of the body, this is again a criminal negligence. So option number B will be the correct answer because it is a type of civil negligence. An error in diagnosis and treatment is civil negligence. So next question is, all are the advantage of fingerprinting system except. So fingerprint of identical twins are usually similar. No, this is an incorrect option. It is applicable to all person of all ages. This is true. Absolute identification is possible. This is true. Print can often be obtained even from putrefied bodies. This is also true. So answer will here will be option number A, which is an incorrect statement because fingerprint cannot be same even for identical twins. All are the clinical signs and symptoms of organophosphate poisoning except. So if we talk about the various signs and symptoms of OP poisoning, then these are sludge, MB. So sludge, salivation, lacrimation, urination, increase in GI motility, E for emesis, M for meiosis, and bradycardia, D for defecation. So if we talk about the option, then increased sweating, yes, this is seen. Increase in lacrimation, this is also present. Sinus tachycardia. No, this is not true because bradycardia is seen, not sinus tachycardia, and meiosis is seen. So answer here will be option number C, sinus tachycardia, which is not a feature of OP poisoning. All are the clinical signs and symptoms of Dhatura poisoning. So if we talk about Dhatura poisoning sign and symptoms, then these are 9D. First is delirium, diplopia, dimness of vision, dryness of mouth. So dryness of mouth is decrease in salivation. Dysphagia, dilated pupils, dry hot skin, drunken gait. So now let's look at the options. Dry hot skin, yes, this is present in Dhatura poisoning. Increased salivation, no, this is not true because decreased salivation is there. So this is incorrect. Dilated pupils will be there and delirium will be there. So here correct answer is option number B. Increased salivation is not present in Dhatura. Instead, decreased salivation or dryness of mouth is present in Dhatura. Swallowtail appearance. Swallowtail appearance occurs due to the tearing, and it can be seen in laceration, contusion, and abrasion. But among the options, best answer is lacerated wound because it is mostly seen in the lacerated and the contusion only. So answer will be lacerated wound. Which of the following should not be done in case of exhumation? The grave site should be positively identified. Yes, this is true. It should be conducted in a natural light. This is true. The body is exhumed only when there is a written order from the executive magistrate. This is again a correct option. Use disinfectant to disinfect the body. This is not correct. Uh, Nothing should be done with the exhumed body because uh, it may lead to the destruction of the evidences. So nothing is done with the exhumed body. So answer will be option number D, that we do not have to use anything on the body. So this is all about FMT questions, and I have also covered other questions in different videos, so you can also see them. And if you have any doubt regarding any question, then you can comment below. Thank you so much.